goal today is that you go
And
home.
can you hear? Do I need to get the microphone or?
Let me know, and I can speak louder. I have a pretty big voice.
I have a microphone, but.
Both of us are kind of hard to hear.
Yeah, so I'll make sure I face you, but certainly, you know, I'll be paying attention. If you're giving me a look like, what are you talking about? I'll repeat myself. Our clinic is in Ipswich, right on Route 1. I don't know if you're familiar with Ipswich at all, but where the old Tri-City sales space used to be, across from the old driving range that used to be there. So it's a great location. We just opened in May. I have a second clinic in Reading off of 128, but I live in Ipswich, and one of my goals was to service the area closer to home. So I'm still in Reading 2 days a week, but also newly in Ipswich. So we're really excited to be there. One of our goals is community outreach. So we've done talks at the Raleigh Senior Center. We've done a talk at the Ipswich Senior Center. And always want you to know we're there for a resource, even if it's not coming in for physical therapy, but even to help you find, avenues that you might need. So just know that we're here for you. And we're not a high pressure sales kind of place. We're really about just helping improve quality of life. So that's where we're coming from. So I'll just go to let's see if I can figure out how to do that. There we go. So sometimes people don't think we can do this, but we really can reduce your risk of falls. And some stuff is just really simple, and some stuff's a little bit more complex. But I'm assuming that you're like me, that sometimes life kind of just gets in the way, and something that you meant to sort of pay attention to kind of got pushed by the wayside because you're off to the next thing. So sometimes it's nice just to sit down and think about it and say, okay, am I doing all the things that I need to do? Yes. Am I doing all the things that I need to do to prevent a fall? So knowing that you came here today, I'm going to assume there's some people that are concerned about falling. And so hopefully you'll leave with something helpful today. So if you're going to be over there, I'm going to go this side so I don't keep walking in front of you. All right, there's a lot happening for us to stay upright. And we take it for granted, but it's good to talk about it. So balance problems occur when one of the four systems is not working correctly. Our vision. Have any of you ever found it harder to walk when it's dark out? Anybody? Yeah. Easy to say. Or if your glasses, the prescription's changed, do you find it a little bit harder to be balanced? Yeah. Maybe somebody's had cataracts and they haven't been repaired, or maybe somebody that you know has glaucoma and things are cloudy, increased risk for fall. We do some tests in the clinic where we'll have you stand feet together and then close your eyes, and you'll see that your balance changes significantly when you close your eyes. So that's one of the systems, and it's, the human body is amazing because all these systems are working together all the time, and we don't even think about it until one of them isn't carrying their own weight. And then we say, what's going on? Your inner ear. Has anybody had any vestibular issues, any vertigo? Yeah, so the inner ear plays a huge role in our balance, and it's meant to. It's kind of like a level, but it's a circular level. And you know what I mean by a level? Like you go to hang a picture and you want to make sure it's straight. We have that built in our head, and it's telling us, okay, are you upright? Are you sideways? How are you? And when that gets a little off kilter, woo, that could be really tricky. Almost, there's some people that feel like they're on a ship all the time, that they're always rocking, and that's when there's a vestibular piece in play. The muscular system, well, it makes sense, doesn't it? How am I standing upright right now? My muscles, my bones and muscles are holding me upright. So if I'm weaker in the core or in the legs, or I'm not walking the same as I normally walk, then all those pieces put me at an increased risk for fall. And then just your awareness in body position. What I've noticed as a physical therapist is that when we are not challenging our bodies in bigger movements, we aren't able to correct ourselves when something changes. So let's pretend that I'm walking down the street in Boston, and if you haven't done that recently, you remember all the cobblestones. And it's really easy to trip in Boston, in my opinion. So you take a misstep, but you're not used to having something change underneath you, well then that means you're more likely to fall. Proprioception is knowing where your body is in space and practicing it. Really easy ways to practice it, either through physical therapy, but through health and wellness activities or exercises in your own home. There's lots of different ways to work on it, but you want to know where your body is in space. And we call that proprioception. So what can increase my risk for falls besides changes in all those systems? Well, the research shows us that if you're over 80, you automatically have an increased risk for fall. Doesn't mean you're gonna fall. It means that you wanna be aware of it and work on it. Leg weakness. Again, just like we talked about the muscles, if these muscles aren't able to hold you up, then you're at an increased risk for falls. Difficulty with balance or walking. I know that's a kind of is like, yeah, no kidding, but there's, some people with MS or Parkinson's or a total knee replacement or a total hip replacement, our walking and balance has changed. So we need to work on that to improve those things. Vision problems, like I spoke about with the glaucoma, with cataracts. One thing that we do know is we're more at risk for fall the time we change our prescription. So you would think like, oh, I'm changing my prescription, so that's awesome, I'm not gonna fall. But there's a transition period where your brain is getting used to those and your eyes are getting used to the glasses. So it's just something to note and say, okay, well, maybe I shouldn't go for that walk in the dark tonight because I just got new glasses today. Give your body a little bit of time to acclimate. And then medical conditions like we talked about MS and Parkinson's, but also dementia. We'll talk about medications. We know a certain number of medications, over 5 medications can increase our risk for falls. We also know that how medications interact can increase risk for falls, or like antidepressants, pain medications, all of those pieces. So this is myself and Mary Kate, and for Halloween we were bacon and eggs. So, and the trampoline's supposed to be our frying pan, so I was sizzling the bacon. It's just the two of us. I don't have a patient care coordinator yet. We're still like a small practice that's developing. What's neat, I don't know if any of you have heard of Bay State Physical Therapy before. We actually have 50 locations. We might be opening like the 50th one right now. But each practice, what I love about it is it's like a small big company. It's not a franchise, but it's an independent company, but each one's partnered with a physical therapist. So I'm the managing partner of both Ipswich and Reading. What I think that you get out of that is you get that we're not like you're just a number. Like we know people's family background, we know, who's helping care for you or who you're helping care for. We know when you're going on vacation, it's just us, and we really work hard on taking care of the whole person and like I said, being a resource for you. The flip side about being part of this larger company is that enables us to take all insurances. That gives us like the back of the house credentialing so that we can, one, make sure we're certified with the insurance companies, but also that the billing goes out in a timely manner. If there are issues, they're there to help us. So I think it's a great thing. It lets me spend more time treating too, where if I was doing that all by myself, then I don't know when I would have time to treat because that's insurance stuff takes a lot of effort. And like I said, I've been in Ipswich. I have 4 children. I've raised them all through the Ipswich Public Schools. I have 1 left in high school. I have 3 in college right now. You guys have been there, I'm sure. It's like, whew. And then, they're home for the holidays, and you know what that's like too. There's no food left in the refrigerator, and there's a lot of laundry. So you guys know. But it's great, and I love this area. So beautiful. So this was, I think I spoke about this when we first came in, but on the Google map, that's where we are, right near that Cumberland Farms at the intersection of Route 1 and Liebrook Road. And I still have not decorated in the space, but we do have all the equipment that we need, and it's very open, clean, and friendly. So now you guys have to work. So, we're gonna do this quick screen, it's a time chair test. It looks like nobody's on wheels, so that's fantastic. We don't want you on wheels, but I do want you to pull your, if you don't wanna participate, no pressure, so know that. But if you flip over your packet to the last page, the back of the last page, so you should just be able to flip it. The time chair test is there. So it might be the second test. May I see? Yeah, so it's at the top of the right-hand column, and that's what we're gonna do. So, ideally, when you do this test, may I steal, no, is anybody here? Nobody's here. I'm gonna steal this chair. So we wanna just make sure these chairs are stable and that they're not gonna slide out behind you. So do me a favor, when you do it, just test it, make sure it's good. We're gonna start in sitting with our arms crossed, and I'm gonna get my phone out and do the timer. And for 30 seconds, you're gonna count your own individual how many times you can get up and get down. Then on that piece of paper, you'll circle where you land. And that's just telling us if you're at increased risk of falls or not. You don't have a paper? Anybody else not have a paper?
You can't do, some people have a hard time hearing.
Okay, thank you. Yep. Well, and you know what we can probably do is I'll get the, okay. Sure, okay. If you missed some of the things that I said, what we can do is I'll send the PowerPoint to the senior center, and then we can print out some copies, and that way everybody can get the information too. That helps. Anybody else? Yeah. Anybody else? You look good. Okay. Let's get timer out. So I'll know you want to participate if your chair is moved away and you have room to get up and down. And if you don't want to participate, no problems, okay? So I'll say on your mark, get set, go. The timer will go for 30 seconds. You're gonna count. You keep your own count of how many ups and downs you completely go. Don't push yourself to be like, I've gotta win this race. Not a race. Even though I'm saying on your mark, get set, go.
You don't know me.
It's that's a good question. So this would be 1, 2,
All the way up,
yeah, 3, okay? Any other questions before we start? Not a race, nobody's allowed to pass out after this, right? You should not get sweaty, well, you might get a little sweaty. All right, on your mark, get set, go. You have 10 seconds left, just so you know.
2. Look at all the show-offs.
And time.
3.
So before you forget, write down that number, and then you can see where you fall on the, I'll help you. So the good thing about this test is it's giving you your baseline. It's certainly something you could practice at home. And the good thing about it is you will get stronger just by practicing this. So it's not magical, your muscles will get stronger. Now if there was a lot of pain with it, obviously that's something you want to talk to either me or your doctor about. Obviously if you were dizzy, that's something we want to talk about as well. But the reason we give you this piece of paper is if you're like, ooh, that's not so great, then this is a great conversation starter with your physician. So just know that, like, it's a resource for you, okay? So the next one is the single leg stance test, and I believe that's on your sheet for the next part. Right here, single leg stance. So if you'd like to participate, I'll know that you're gonna stand behind your chair. And if you don't wanna participate, totally fine. And what we're gonna do is I'm gonna have you pick up your leg, and then I'll have the timer going, but really you can count 1 Mississippi's. So 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. Less than 5-second hold is an increased risk for falls. So if you would like to participate, stand up for me. And if you would like, I can count out loud. If you find it easier to count in your head, I won't count out loud. What would you guys like to do? Count in your own head? Or would you like me to count? I'll count, but then you have to pay attention to where you're stopping, because I won't be able to tell you all where you're stopping, okay? So you can't hold on. No. Yes.
Can't hold on. What can't do?
If you were going to fall, you were like, there's no way I'm doing this without holding on, what do you think you should do? Hold on, and on your piece of paper, write down, I had to hold on, so that when you talk to your doctor about it, or when you talk to me about it, we knew you held on. So you modified it in a safe, smart way. Safety is always number 1. So no, this is no fall zone. We're not gonna have a fall today, because that's, against all the rules. Yes?
Should you do this with both feet? I mean, do it once.
I'll tell you, yep. So the first one we'll stand on the right. Okay? All right, ready, set, go. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi, 11 Mississippi, 12 Mississippi, 13 Mississippi, 14 Mississippi, 15 Mississippi, 16 Mississippi, 17 Mississippi, 18 Mississippi, 19 Mississippi, 20. Anybody still up? Great job. Good. So write down your number. If you're standing on the right, you can just put an R for right and your score.
Were we supposed to go up and down or just stay?
Just hold.
Oh. I need to go to that strength class.
All right, are we ready for the other side? Don't be discouraged. I see some discouraged faces in here. Don't be discouraged. This is just a moment of, you remember how I started in the beginning of the talk? I said we all get busy about doing our things and we don't take time to just go, okay. Well, this is your time to say, okay, do I have everything I need? Is there something I need to work on? That's all it is. So don't be discouraged. Think of it more as like, hey, this is really cool. I know what I need to work on now, and I'll put those things in place to work on it. Okay, so don't be discouraged. Standing on the left. Ready, set, go. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi, 11 Mississippi, 12 Mississippi, 13 Mississippi, 14 Mississippi, 15 Mississippi, 16 Mississippi, 17 Mississippi, 18 Mississippi, 19 Mississippi, 20 Mississippi, 21. We can stop at 20. Good. Awesome. And you can just put greater than 20. Fantastic. And now you may have a seat. Great job participating. And I think we talked about the purpose of that and what we're going to do with it. So based on those tests, if you found that you had an increased risk for falls, you're welcome to reach out to us. We could do a free screen for you where we would do more balanced tests in the clinic. Again, no pressure, just know that that's an option. Like I said before, follow up with your primary care provider. You can go see physical therapy just for your increased risk of falls. I imagine most people here have Medicare. What we know about Medicare is they're very in tune with falls because that tends to be a big piece in life. Like if you fall and end up needing surgery or something like that, it ends up being costly and also can be a big drain on your health that we don't want to happen. So we do have that support. Is it time for us to change classes? It's lunchtime, okay. And then we're gonna talk about the home health stuff in just a minute, or the home assessment, but work with your family members to improve your surroundings. And we can go into that right now. My mom lives in a small apartment in Wenham, and I went in and did a home assessment for her. And she's like, the reason I did it is, I said, Mom, how are you doing? Like, you know, getting up and going to the bathroom in the night, is it clear and everything? She's like, oh, it's fine, I don't turn the light on and I just feel my way to the bathroom. And I go, okay, Mom, we need to talk. So we came in and did an assessment, or I came in and did an assessment, and I gave you this sheet here for you to bring home with you. And you may, just from memory, go, oh, I know this and this and this. But sometimes we don't even notice the things that we have in the way. Maybe it's been there for so long, it's kind of just part of the landscape. Throw rugs are a big hazard. So if you have a throw rug on like a tile floor or a wood floor, that's a really easy thing to get tripped up on. So you want to look at those. Extension cords. I know a lot of the older houses, like it's not great lighting, and we tend to have lots of lamps, which means we have lots of cords. So we want to look at that. Railings. I had a patient one time who had a terrible time with his hip getting up and down the stairs, and his office was on the second floor, no railings on the stairs. And I was like, so he hurt his shoulder. It was actually a hip, but he hurt his shoulder because he was pulling himself up the stairs with one rail. He had one railing, no railing on the side he couldn't pull up. So sometimes you need two railings. Look at those things. In the bathroom, in the shower, we always encourage people, they do have these grab bars now with suction cups. We don't love them. And I'll tell you why, because they're not that sturdy and you can't trust them. And if you think about when you typically need to grab a grab bar, it's when you need that extra support, and we can't worry about it falling. I know it can cost some money to upgrade some of these things in your home, but it's really worth your time and safety, because in the long run it'll save you big headaches. Spend some time to look at the house. If the stairs are slippery, make sure that you have some treads on it. If the lighting is not so great, try to find a way to get more lighting. Mary Kate, who's my other PT, they gave her grandma Alexa, and with the lights, and she can tell Alexa to turn the lights on to go into the next room. I think of some of the wiring in my house, like I have to walk through a room to go hit the switch, which means I'm walking through the dark to go turn the light on. Makes no sense. But with some of that technology, how great is that? And just very easy. That's where you would want to, you know, I joke all the time, like if I can't figure out on my phone, I go to my 16-year-old and she'll tell me what to do. So if you know a young person in your life, they'll figure it out, and it'll take them 2 seconds, so don't work through it, because I don't know, they're just better at it than we are. So please take the time to, hopefully today you'll take the time to look at your house and say, what can I modify? I had another couple, she was using a walker, but she couldn't fit the walker in the bathroom. So every time she had to go to the bathroom, she had to leave the walker outside the door and hold on to things as she went into the bathroom. And that's a big conversation for me to have with somebody, right? I'm saying your bathroom isn't sufficient, so what are our options? We need to either do construction, widen the bathroom, we need to get a bathroom on the first floor, we need to figure out something. So I know those are harder conversations, and those would be great conversations to have with loved ones, so you guys can discuss it and say, does this make sense? But it's always those things that, you know, we don't want to push it aside, because your health and safety is number one. Okay, so I hope you find these helpful. And I didn't say, Ray, don't ignore symptoms and take control. I'll have some people say to me, well, I've had a bum knee, so this is just the way I walk. It's like, but if we can improve your bum knee and we can improve the way you walk, then that's fantastic. One thing that I noticed about being in PT too can also be One, it's social, just like the senior center, which I love, and I'm always pushing my patients to senior centers because I feel like you're an outstanding resource for the community. And I noticed that seniors today, nobody wants to be a senior. Everyone's like, that's what I get all the time. Well, I don't want to be there. Everybody's my age. And I'm like, but you're all young. You're all young your age. I think it's very different than, you know, maybe 30 or 40 years ago where it was very sedentary and you didn't do things. You are an active group of people, so I'm always encouraging, keep going and keep offering these great programs that you have. But what else is great about PT is sometimes, you know, we have a lot of pain and we're afraid to be active or we're afraid to do something wrong, and then we start to close in our world a little bit, and PT gives you that opportunity to get comfortable with your body again and say, oh, I can do this and I can push myself harder and I can do this because you have the safety and support. Then as you discharge, you go off and continue to do it. So I think there's a lot of great resources there. How can we help? We can help reduce your risk of fall and your fear of falling. Believe it or not, a fear of falling is also a risk factor of falling. So let's pretend I'm walking on the ice and I'm worried about walking. Do I walk my normal walk? No, I start to do this, and I might just focus on this. I might focus here, wherever. It changes everything, and that actually increases my risk of falls. Improving mobility, balance, and strength. Flexibility, all those help. One exercise I love to do with folks who are working on balance is quite simply big stepping. So I big step forward, side, back, at an angle. And if you think about your daily life, and this happens, I swear it happens like from 25 up, when we stop participating in sports, we don't put ourselves in these big type positions. We tend to get smaller and smaller and smaller. So if you think of big, and even if I add in my arms, I'm big. Do you see how I'm training my body to get comfortable? Where one, I'm standing on one leg for a moment, and two, I'm not staring at where I'm stepping, which is what we call that proprioception. So just practicing this and practicing it with the other leg, getting comfortable, just a great thing to do to start opening up space. Now, if that was too hard, you obviously would hold on to a counter. Kitchen counter is a great tool because it's right at my side and I can practice stepping. And your step may be this big to start because that's beyond your comfort zone, that's okay. But just practicing those things. Increase your activity levels. Join a gym, join the exercise classes at the Council on Aging, get out, go for walks. If you have grandchildren, play ball with them. It can be you both are standing here and I throw a ball to you and you throw a ball back to me, just bouncing it. It doesn't need to be a basketball, just a playground ball. That is a great thing to do, to just practice your coordination and movement. Make sure that you consult with doctors. Keep checking in. Like if you have different doctors prescribing different medications, make sure that primary care and also your pharmacist can be a great resource. Hey, do these really all make sense together? Because sometimes it gets lost in the shuffle. And if you started to take a new medication and suddenly you feel like more lightheadedness or you feel dizzy or something feels off, don't just be like, oh, well, they told me that's a side effect. Report it back to the doctor. Because I think sometimes people think that. They're like, oh, well, it is what it is. Well, there's so many different medications, and if there's a way to change it, and if it's impacting your life, at least have the conversation. I think that's really important. Make sure you're going to the eye doctor regularly. Make sure you're getting hearing checked. Oops. And I think that's it. And that's it. So I thank you. Questions now. Any questions of me?
One can only see a physical therapist if they have a recommendation from the physician, right?
So it depends on your insurance plan. If you have Medicare, we do take Medicare. You would need a prescription from the doctor. That's where this piece of paper could be a great thing to talk to them about. Typically Medicare pays 80% and you have a deductible. I think it's $168 right now is the deductible, or $198. I'm not remembering. Your secondary insurance, we call and check to make sure your secondary insurance picks that up. Many people with Medicare, I'd say for me personally, 90% of people with Medicare have no copay, that the secondary insurance picks it up. I have had some folks that they have to pay like a $15 copay for each visit. So I do have my cards back there. You could take anything, you know, to the doctor that you would want to. They would fax over the prescription. You would call and say, Heather, I'd like to start physical therapy. But no pressure. I just want you to know that. Just a resource. Yes. Other questions? Yes.
We'll probably find this out next week, but we were just talking at the table. Is there a difference between arthritic hip and when they diagnose it as severe degenerative hip?
Yeah, so a lot of those words can be interchangeable. So severe degeneration is they're typically seeing so much of changes either in the ball or the socket that they want to do something about it. So it would typically be that they're looking at a total hip replacement. It is arthritis. It's just intense arthritis. You also have a labrum, which is, so if you think of the ball and socket, and you think about both our shoulder and our arms have labrums, and there's a lot of motion, right? And with our hip, there's a lot of motion, but that socket is pretty shallow, so it has a piece of cartilage that goes right on the outside that kind of makes it like a suction cup. And if that has degeneration in it, you're not as stable in there either. So if you're a little less stable in the hip and then you've got some bony changes, like think about it walking on like a smooth surface versus a potholy surface, you can have more pain in there. Yeah. So they're the same but more intense, if that helps. Does that answer everything?
Yeah, no, I already have a hip replacement.
Okay. So you got a nice ball and socket in there.
I have titanium and plastic.
There you go, bionic woman. Yes.
Would that be the same for your knees? you know?
Yeah.
Because that's why I couldn't really stand on my leg.
Yeah.
But my knees are fine as far as the bones are concerned.
So other things can be happening in there. You can have some inflammation in there. You can have a meniscal change, which research is supporting physical therapy is as effective as surgery. We typically try physical therapy first and hope we can get there.
What about just the arthritis part? He said the meniscal was fine.
So then the arthritis part, it depends how intense it is. So what we know is that if you think about, if I just took a skeleton, just the bones, we stacked them all on top, there's no space, right? The bones just sit on the bones. If we add strong muscles to that, those strong muscles exactly help hold things a little bit apart. So the stronger you are, the better. What we also know about arthritis is it typically feels worse the first hour or two each day. And sometimes we can get caught in that cycle, well, I shouldn't do this because it hurts. It's not always true with arthritis. So that you need to keep moving and get pushed through some of that pain to get the strength to help hold it better.
So physical therapy would help.
Yeah, yeah. Good questions. Any other questions?
Would physical therapy help pinch nerve?
Yes, yep.
Good, thank you.
Yep. So if it's in the back or the neck or the shoulder,
Some
wrist, pardon me?
On the leg?
The leg typically comes from the back because of all the nerves for our lower extremity, our legs come out of the back.
But if I don't have any pain in the back, why
It's
is it?
okay. It can still be coming from the back.
Is that right?
And then we do the test to find that out. Yeah. Doesn't mean you have a bad back. You
Well,
still
I've had
have
all kinds of tests, but no one seemed to come up with a conclusion.
Okay. And it can also be pinched in the hip, so we will do those kinds of tests and look at it. You can also have leg pain because you've sort of changed the way you're walking, and we've got to just change some muscle imbalances. That's what's so cool. I love
So you
physical
do it.
therapy because it's a machine, right? Our body is a machine, and you get to go through all these pieces and try to figure it out. And everything matters. Like your age matters, but what you do every day matters, and how long you drive to work matters, and if you knit matters. I mean, it's just pretty cool. Like all those pieces are part of the puzzle. Any other questions for me?
When you sit in the car for a long time, you're driving and you have to get out, and it's hard.
Yes.
Is that arthritis or is it?
It can be a combination of things. What we know is that 20 minutes of one position changes even the cartilage temporarily, but it does. Hi there. So
Is there any physical therapy that can be
what we would tell you, for long drives, it's good if you take breaks, obviously, and then the more active and strong you are, the better it is. Yeah. Awesome. Well, I really appreciate you having me. I hope you found that helpful, and I'm looking forward to coming back, once or twice a year.
Would you mind listing your phone number or?
Yep, I have cards back.
Would you say it out loud?
Oh,
Just for-
sure.
Just for our viewers at home.
Yeah, sure. I better read it though. I have to remember the clinic phone number.
It's here. Okay. And then I can keep, and I
Put it
will
at the
keep
front?
cards on hand and contact information on hand.
Great. Okay. So the clinic phone number is 978-312-2804. Pardon me?
Repeat it.
Repeat it. Okay. 978-312-2804. Good.
Thanks
You can
very
tell I'm
much.
not used to the camera.
Thank you.
Thank you. And will you